Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Blood gas partition coefficient equals to blood gas solubility, indicator for induction and recovery of um, anesthesia is blood gas partition coefficient. It indicates whether the induction is faster or slower and the rate of recovery. Alveolar concentration will depict the brain concentration. Examples of blood gas partition coefficient are desflurane 0.42 means the blood concentration of the desflurane is 42, whereas alveolar concentration is 48. So, in blood gas partition coefficient, fastest induction is by overall, it is by xenon, whereas current used, the fastest induction is by desflurane, whereas slowest induction overall is by methoxyflurane, but methoxyflurane is not used now because of nephrotoxicity. So, current use, the slowest induction is by halothane.
The blood gas solubility for halothane it is 2.25, so it has slow induction. For isoflurane it is 1.3, for sevoflurane it is 0.63, and for desflurane it is 0.442. So CNS concentration of an inhalational agent is directly proportional to the alveolar concentration, and blood gas solubility is directly proportional to the blood gas solubility is inversely proportional to the speed of induction. So summary: blood gas partition coefficient, also called as blood gas solubility, also called as diffusion coefficient. So this will tell us about the induction or recovery of an anesthetic agent. The alveolar concentration will depict the brain concentration. The blood gas solubility of different agents: for halothane it is 2.25, so it is slower induction and recovery. Isoflurane 1.3, sevoflurane 0.63, desflurane 0.42, so it has fast induction and recovery. So faster induction is present, fastest is xenon, but current usage is desflurane has the fastest induction. Slowest is present in methoxyflurane and halothane. So CNS concentration of inhalational agent is directly proportional to alveolar concentration, and blood gas solubility is inversely proportional to the speed of induction.
thank you and thank you for watching.